G'day everyone, this is Health Highlights. I'm Simon Ashley. Health Highlights is a show about health professionals and the people and the stories behind the names we often hear about but we seldom get to meet. Now I don't know if you realise or not that each year there is 1 million people injured playing sport. And the Sports Association of Australia actually says that around about 50% of these injuries are actually preventable given the right care. So today we have the great privilege of interviewing one of the most sought after sports physicians in the whole Hunter region, Ross Cairns. Welcome, Ross.
Thanks for having me, Simon.
And look, we're also here in Ross's new facility here at Warners Bay. Beautiful place, Ross. How long have you been here for?
We opened about a month ago. We've been building over that month. We've got multiple practitioners working here now with some of the top sports physiotherapists in the area. We've got sports dietitians involved as well, and we're co-located with some paediatricians. So we've got a real mix of work going on here, but it's pretty vibrant, and we've had a really good response so far from the day we've opened.
That's great, that's great. So is it true that 50% of sporting injuries are actually preventable?
Yes, it is true. That data comes from looking at specific warm-up strategies where you can change what we've classically done in the past, such as stretching. You go anywhere nowadays, you'll see people stretching before they go for a run, you'll see people stopping to stretch during a run, and the thought behind that is that that's going to stop you from injuring yourself by overstretching something. But if you ever look at the actual mechanism of injury behind the most common injuries or the severe injuries, that's very rarely what happens. Normally the problem is due to poor movement or a lack of control in your muscles that can't help your body out when it's in a position of danger, or it's related to fatigue where the coordination of your muscles and your nervous system don't work together properly. So what we've seen is if you can do exercise before you play a team sport in particular that focuses on improving muscle activation and balance control, and practicing common movements like landing on a single leg and catching a ball whilst being distracted by something else, you can reduce injuries in a team, particularly ball playing sports or change direction sports by up to 50%, which is huge. But that's only one aspect. There's lots of ways of preventing injuries, and there's the things that we all are aware of but probably don't do enough of, and that's good recovery after you play sport, getting the right nutrition in, getting good sleep on board. They all help prevent injuries. And there's even more research coming out now about the relationship of acute and chronic loads with exercise and how you can try and prevent injuries by not having sudden changes in your exercise volume or intensity. Which as clinicians we've all known for a long time, but it's starting to come out with scientific basis now, and really it means we've got lots of ways to advise patients of how we can keep them healthy and keep doing what they love, which is being fit and healthy with exercise.
Wonderful. So as a sports physician, are you wanting to see people before they even get injured? Is that going to be helpful for you, or is it more as a sports physician, your role is basically when they injure themselves, you sort of look at them and then their condition?
Yeah, okay, it's both really. There's not going to be the capacity to see everyone that wants to start exercise, but and exercise is very safe in general unless you've got a significant medical condition. And I'd recommend anyone that wants to start exercise that if there's no good reason not to, you should get out there and start just by doing some walking and gradually increase that pace and how far you walk. And if you're not having any symptoms, any chest pain or abnormal shortness of breath, then you should just continue progressing your fitness. But if you have got any problems then and you're not sure of what to do, and that's providing a barrier to you from getting all the benefits of regular activity, that's when you should see someone like myself, where we can evaluate your health issues and we can give you some safe parameters that you can exercise in so you feel comfortable, and then we can progress you. But there's other conditions like pregnancy, for example, where it's not an illness, but it's a change in your body's environment, and it's safe to exercise and good for the baby to exercise. And we can give exercise advice and prescription for pregnant ladies, for example, as well.
Great. So that'd be interesting for our viewers. So what is actually the scope of a sports physician? So how would you look at what you do?
Yeah, it's a hard one to sum up in a nutshell really, because we've got a really varied practice. There's really two facets to it. There's the injury management and prevention side of our job, which makes up the majority of my clinical practice. But there is the exercise prescription element as well that we've just spoken about. But there's also teamwork. So we work with the professional sports teams, whether it's the Jets and the Mariners, or I currently work with the Australian under-23s team. And we provide care to elite athletes that have unique demands in their environment, and unless you work with those people regularly, it's hard to understand those sorts of demands. So we fill that gap, and we're also patient advocates. We are trained in knowing the best non-operative treatments for injuries, and our only interest is to get people better. So we don't have any qualms about someone having surgery if it's appropriate, but we also don't want them to have surgery unless it's appropriate.
Yeah, right.
And we're the best people to help make that decision. And that's where a lot of my practice is focused on what I call non-operative interventions.
Awesome.
Because the word conservative, which is often used, sounds like you're not doing much, but there's a lot of active non-operative treatment that you can have.
Sounds great, that's awesome. So look, reading your bio, Ross, it was really interesting because you could see there's a real passion that you have for what you do. Firstly, one of the questions is why sports medicine? But also, what I was reading is that you actually had an injury when you were younger as a sports or athlete yourself. So has that injury and the management that happened, is that actually been the passion for you to do what you do?
Yeah, look, I think that is part of the driving force. I mean, why sports medicine? Anyone who works in sports medicine has an interest in sport usually because you've grown up loving it, and I'm no different. My passion is football or soccer, and I've always wanted to work in that field in some capacity. But my interest in sports medicine was really peaked twice as I was growing up. Once when I was a junior elite soccer player and had a really quite benign condition called Osgood-Schlatter's disease that I was advised to not play sport for 2 years. And I ignored the doctor's advice, which it's not necessarily advisable, but it created a lot of stress in my family because they knew that there was a potential career here, and we were going against doctor's advice, and there was a concern that if I didn't play I was ruining a chance, if I did play I might be ruining my body. And I've found out since that there was no problem in carrying on playing. So that was one element where I realised that why is this information not coming out? Why are people not knowing this information? And then when I was at med school, I also had a significant knee injury when I was playing semi-professional football. That I went through the system and went to emergency and was given a diagnosis of knee sprain, which at the time I didn't know any different. I took that as that's the diagnosis, and I had no further treatment or rehabilitation, and I didn't get back to playing a high level sport for 8 months. And I've subsequently realised that this situation could have been avoided if I'd had knowledge. But as I went through medical school, that knowledge was never given to any of us. We don't come out of medical school with training on injuries. Yes. And that's where my passion has come from. I've realised there's this gap, and I wanted to learn about it so I can help individuals so they can enjoy exercise, but also if they've got dreams of playing a sport, that an injury doesn't curtail that. But also I want to disseminate the education. I want people to know. So we've gone to the University of Newcastle and we've managed to get sports medicine onto the undergraduate curriculum. So the next generation of doctors in this area, they're all going to have some knowledge on how to treat these problems. And then on top of that, I do a lot of teaching of GPs, even orthopedic surgeons, the physiotherapy students. I've got a medical student here this week, they're regularly placed me. So trying to do everything we can to try and increase everyone's knowledge of these problems, because as an individual practitioner, I can't see that many people, but if we can upskill lots of people and raise awareness, then hopefully we can increase health and of the population in this area.
Fabulous, love it. Love the passion that you have, and that's so important when it comes to anything you do, isn't it? So look, I wanted to talk a little bit about, often there's a bit of a grey line between, okay, so when do you go to see a manual therapist for an injury? And when would you go and say, see yourself? So just sort of giving people an idea of, okay, you've injured yourself, where do I go to?
Yeah. Look, there's lots of different ways to end up in the system, I suppose,
Yes, that's right.
to get treated, and there's no one correct route to go down. I think you can't go and see a specialist for every injury you've got. It's just not practical,
Exactly.
and there's a lot of injuries that resolve by themselves or with some simple manual therapy. So a lot of people don't need to see someone like myself. But the best system I've worked in was when I did, it was called an interstate year. It was like a fellowship year in Melbourne, where I worked in a multidisciplinary environment, just like here, where we've got excellent sports physios and sports dietitians and myself in the same site. And what would happen is people knew we were here as a tertiary centre for injuries, and they would present early, and they would come in not knowing what the problem was. And by the time they'd left, they'd have seen myself for a diagnosis, they'd have a treatment plan, and often if they had time on the day, they'd see the physiotherapist and they'd start their treatment plan, and they'd go home with a positive frame. They'd know their prognosis and know where they were heading. And so that's the system I've worked in that's been the most useful.
Really?
And the system that's most difficult to be involved with is when someone hasn't got a diagnosis, but they've been treated by manual therapists for sometimes years. And by the time they get to me, they're quite distrustful of the medical system or the private system. And they've spent so much money that they really don't know where to turn and are not sure of what to do. So I think it's great, whoever it is, if they can treat people early on, but if they've got a sense of something's not getting better or they're just not sure, it's to reach out to other experts and get that advice and work closely with experts so you can upskill yourself for the benefit of yourself and your patient.
That's great, yeah. That's great. So let's go now to the other side of the spectrum, sports physician and orthopedic surgeon. So obviously there's a bit of overlap there. I'm sort of, here, as you've talked, I'm sort of seeing a little bit of where you fit in and where they fit in, but can you give the viewers a bit of an idea of, okay, when do I see an orthopedic surgeon, when do I see a sports physician?
Yeah, sure. I mean, look, there's clear overlap between the areas, but what we're seeing now with the newer generation of orthopedic surgeons and sports physicians is that we work collaboratively together.
Right.
Orthopedic surgeons tend to be trained in one, maybe two joints, and their training is predominantly on surgical treatment. It's not necessarily in the non-operative treatments, and they are trained in some diagnosis, but perhaps we have a bit more training on difficult chronic pain diagnoses. So when there's a difficult problem, when you see a sports physician, you're going to see someone who knows a lot about every joint in the body and sees the body as a whole. You may get similar treatment from an orthopedic surgeon, you may not, but what I would generally say is that there's almost no musculoskeletal problem, whether it's joint, bone, unless it's fractured and displaced, ligament, tendon, that doesn't have a good outcome with non-operative treatment first.
Right.
So I would recommend for almost all injuries that an orthopedic surgeon is not the first port of call, but if you go down a non-operative pathway and you do rehab and you haven't responded as most people would based on science, then it's completely appropriate to seek surgery for those avenues. But if you go for surgery first, you're exposing yourself to surgical risk, the cost, the time off work, and you may not have needed to go down that pathway.
And do you find that even doing that initial work, if you had an injury and you're doing some of that other rehab first, that actually, when they do go to surgery, that their response to that surgery is actually better because they've actually worked that area?
Of course. So if you've got stronger muscles and better joint range before you have surgery, then you've got less recovery to make after the surgery. So in general, if you are stronger before you go in, you're going to be better afterwards.
Yes.
Yeah.
Brilliant. Brilliant. Well, I think that's really informative information and very helpful for a lot of people to sort of work out where their injury fits into the scope of the whole medical system, which is great. So finally, what are your, and you sort of alluded to this a bit, but we just wanted to sort of lock it down to a couple of key tips about preventing or injury recovery. What are probably your big tips about once you've injured yourself, what are the best things that they can put in place to actually get to recovery?
Yeah, so the first thing is minimizing what I call dysfunction. So whenever you have any acute injury, early on you get pain, you get swelling and you get inflammation. Now, all of those things, they prevent the muscles from working properly, and they affect the range of motion in your joint. So very early on, within hours of having your injury, if you can do active treatments to prevent those or minimize those, you're going to help your recovery. So good strong compression to prevent that bleeding and swelling. Some ice can be beneficial. If it's just analgesic, it's beneficial. Sometimes anti-inflammatories, and not immobilizing the joint unless you have to. If you immobilize something, it's going to get stiff, and if you don't use it, you lose it. It's true.
Yes.
So for an ankle sprain, for example, if you can weight bear on it, weight bear on it.
Okay.
So that's the first point. Then you need early good diagnosis. Whoever you're seeing, you need good diagnosis. People say a simple ankle sprain, but there's a lot of associated injuries with an ankle sprain that you want to rule out. So yes, treat the ankle sprain, but make sure nothing else is going on, and then move on to evidence-based treatment with a practitioner that is an expert in that field.
Sounds great.
And finally, if you're not getting where you need to go, then get help.
Okay.
Seek advice and see it as a learning experience. We can't fix everyone.
That's right. Look, that's fantastic information. Thank you, Ross. You can just see the passion and the knowledge that this man has. So if you want to find out more about Ross, you can jump on his website, which will be on the screen right now, or you can give him a call, or if you want to make a comment, we can actually ask Ross a couple of questions that I'm sure he'll get back to us and we can let you know. So thank you so much for joining us. Remember, 12:30 Wednesday, we'll be here next week. We've got an incredible interview lined up for you. So remember, healing is a gift, health a responsibility. Have a great week. Thanks, Ross.
Thanks, man.